AP 120, Chapter 7, Bones of the Skull. So we're moving on to the axial skeleton, and we're going to start off with the skull. Turns out the skull has a lot of spaces within it. It has the cranial cavity where we find the brain. It has the oral cavity, opening for the digestive system, the nasal cavity, the opening for the respiratory system. And also coming off of the nasal cavity are the spaces within bones referred to as sinuses. Frontal sinuses in the frontal bone, ethmoid sinuses in the ethmoid bone, maxillary sinuses in the maxillary bone, and sphenoidal sinuses in the sphenoid bone. So here's just another view. Again, these sinuses are actually inside of bones. We cannot see them unless we cut open those bones. They're there to lighten the weight of the skull by having there be less bone tissue, to act as a resonance chamber for sound when we speak or sing, um, and so forth. And that they are all connected to the nasal cavity, so they all empty into the nasal cavity. All right, the skull is made up of 22 bones. Surprise, the skull is made up of 22 bones. 8 of those bones are known as the cranial bones. The cranial bones form the cranial cavity. They're the bones needed to form the cranial cavity. It includes the frontal bone, 2 parietal bones, 2 temporal bones, occipital bone, sphenoid bone, and ethmoid bone, and we're going to talk about all of them. Now, when bones of the skull come together, they form joints called sutures. And these sutures are fibrous joints that are immobile. They do not move. They're just attaching bones strongly, tightly together. Now, there are 4 sutures found among the cranial bones that you'll need to know the names of. There's the coronal suture, found between the frontal bone and the parietal bones, the sagittal suture at the top of the skulls, found between the 2 parietal bones, the lambdoid suture between the parietal bones and the occipital bone, and then on the right side we have the right squamous suture between the parietal bone and temporal bone, and on the left side the left squamous suture between the parietal bone and the temporal bone. All right, frontal bones. Frontal bones possess sinuses. Frontal bones help form the coronal suture, and they also help to form the cranial cavity, the orbits, see they form the roof, and the nasal cavity. There's a nice frontal bone. Parietal bones. Parietal bones are big, flat bones at the top of the skull. They help to form all 4 major, or 5 technically, sutures, major sutures that you need to know. And they also help to form the cranial cavity, roof of the cranial cavity to be exact. Then we have the temporal bone. Here is the temporal bone. It's a lateral bone. There's a right and left temporal bone. Helps to form the squamous suture. Helps to form the cranial cavity and also houses structures of the ear. There are some important surface features, some important bone markings that you need to know. There is this hole going into the temporal bone. That is the external acoustic meatus. You probably notice the ear canal. So the temporal bone has the external acoustic meatus. Inferior to that is this large rough patch of bone tissue called the mastoid process. Anterior to that is this thin little spike of bone called the styloid process. And then there's this thin piece of bone going across and toward the anterior side called the zygomatic process, which actually articulates, forms a joint with the zygomatic bone. So mastoid process, styloid process, zygomatic process. They're all, of course, attachment sites for muscles. Then there is this little depression here called the mandibular fossa. Mandibular fossa is where the mandible fits in and articulates with the temporal bone, forming the only movable joints in the skull. Here is an inferior view of the skull. Here's the anterior surface, posterior surface. Here is the occipital bone. Occipital bone is important, helps to form the cranial cavity, especially the floor of the cranial cavity. helps form the lambdoid suture, and also articulates with the vertebral column. It is the bone of the skull that rests on the vertebral column. Now, when we take a closer look at the occipital bone, we see that has this large hole. This hole is the opening for the spinal cord. The spinal cord comes out of that, and that hole is called the foramen magnum. Foramen magnum. And then on either sides of the foramen magnum are the smooth rounded knobs called the occipital condyles. The occipital condyles are the structures that articulate with, form joints with the vertebral column. Here is the sphenoid bone. Sphenoid bone is rather funny shaped. It is a deeper bone, so there's very little of it actually at the superficial or surface of the skull. Most of it is a little deeper into the skull. Helps form the cranial cavities, the orbits, back of the orbits, and the nasal cavity. It possesses the sphenoidal sinuses, and it articulates with every other cranial bone. So it's often called the keystone because it articulates with every other cranial bone. Here is a lateral view of the skull where we can see a part of the sphenoid bone at the surface of the skull. We can remove the top of the skull and look down into it. Here is the sphenoid bone, sort of in the middle of the skull, shaped kind of like a butterfly or a bird maybe. And there is a large depression on the surface of the sphenoid bone, and that depression is known as the sella turcica. And the sella turcica is actually where you'd find the pituitary gland that's found in the skull. All right, here is the ethmoid bone. Ethmoid bone is a blockier bone. You can see it has two large areas and then a plate in the middle. The ethmoid bone is very deep. You cannot find it on the surface of the skull. It helps to form the cranial cavities, the orbits, and the nasal cavity. Also helps to form the nasal septum, that wall in the middle of the nasal cavity that separates it to a right and left side. And all these openings show you the access to all of the ethmoidal sinuses found within the ethmoid bone. So here is, again, we took off the top of the skull, looking down into it. This purple area here is the ethmoid bone. The point is like a shark fin, this little point coming up. It's called the crista galli. And then the tissue around it, tissue around the crista galli is called the cribriform plate. You can see all these teeny tiny holes that allow the nerves from the nasal cavity to reach the brain. But here is that plate coming down. This is the perpendicular plate that's helping to form the nasal septum. And so this is coming down into the nasal cavity. Here is a view of the nasal septum, that wall that separates the nasal cavity to a right and left side. Here's the perpendicular plate of the ethmoid bone. Down here is a bone called the vomer. Talk about that more later. And then this piece of cartilage that's anterior toward the front, and that's called the septal cartilage. So three parts of the nasal septum: perpendicular plate of ethmoid bone, vomer, and septal cartilage. Fontanelles. So where we have sutures in adults, we had in infants incomplete sutures that were called fontanelles. So the intramembranous ossification process is incomplete in infants, so there's still that more delicate connective tissue between a lot of the bones of the skull. And so that those incomplete sutures are referred to as fontanelles. And so this is why the skulls of babies have that little soft spot. And also it means their skulls are a little more malleable for the birthing process. Facial bones. There are 14 facial bones. 2 zygomatic, 2 maxilla, 2 lacrimal, 2 nasal, 1 vomer, 2 inferior nasal conchae, 2 palatine, 1 mandible. So the lacrimal bones are part of the orbits, so they help to form the orbits. They also help to form the nasal cavity, and they have little ducts, little openings that connect the orbits to the nasal cavity, so tears can flow into the nasal cavity. At the bridge of the nose, we have the right and left nasal bones. Again, help to form the nasal cavity. Our cheekbones are the zygomatic bones, and they also help to form the orbits, as you can see here. Then we have the vomer, that triangular little bone that helps to form the nasal septum. Here you can see it head on, as it were. We have these two bones on each of the lateral walls of the nasal cavity. Those are called the inferior nasal conchae. Inferior nasal conchae. And they're part of the lateral walls of the nasal cavity, and they push out into the nasal cavity, providing a way to break up the air coming in so it gets swirled within the nasal cavity. This is an inferior view of the skull with the mandible removed. This bone here is the palatines. We have two palatine bones, a right and left palatine bones. You can see a part of one of them. They form the posterior or back portion of the hard palate, the roof of the mouth, and they also help to form parts of the nasal cavity and the orbits. Here is the maxilla, right and left maxilla bones. They help to form the nasal cavity, the orbits, the oral cavity, and they hold the upper teeth. So the upper teeth are embedded in the maxilla. Here again is the inferior view of the skull with the mandible removed. The anterior portion of the hard palate is formed by the palatine processes of the maxilla bones. And of course, they articulate with the palatine bone. So again, you have the palatine processes of the two maxilla bones helping to form the anterior portion of the hard palate or roof of the mouth. Cleft lip is when the lip doesn't fuse properly during development. It's pretty easy to repair with some surgery. The cleft palate is much more severe, where the palatine and maxilla bones did not form completely, did not fuse together, and so there's a space connecting the oral cavity to the nasal cavity. This can cause a lot of problems for the child, and so it ends up being corrected by a series of surgeries over years. Pretty severe birth defect. All right, and the mandible. The mandible is the jawbone. The mandible holds the lower teeth, and the mandible is the only movable bone of the skull. It's the only bone of the skull that moves on its own in relation to the rest of the skull. So the mandible has this portion of bone sticking up called the mandibular condyle. Mandibular condyle forms a joint with the mandibular fossa of the temporal bone, and this is the movable joint on the right and left sides that allow the mandible to move, to let us chew and stuff. And that is it for the bones of the skull.